A newly peer-reviewed study from the Cleveland Clinic found that the risk of COVID-19 varied by the number of COVID-19 vaccine doses previously received. And the higher the number of vaccines previously received, the higher the risk of contracting COVID-19.
Popular YouTuber and comedian who has been a prominent skeptic over vaccines and mandates throughout the pandemic, Jimmy Dore, tweeted, "FYI, it's not a vaccine, it's a failed experiment. We are the guinea pigs." All right, take these findings with a grain of salt. But this is interesting because this first came out earlier this year, I think around February, and there was a lot of pushback at that time. Part of the pushback was that it was not a peer-reviewed study. It was just what's known as a preprint. Now we're talking about this again because it has been peer-reviewed, and the parts of the study that raised a red flag to some vaccine skeptics are still there in the study. So, go ahead.
Yeah. So the authors of the study note that this is unexpected. Like, I don't think these are people who were. These are not like anti-vaccine people who were setting out to disprove the efficacy of vaccines. And so they're saying there was an association of increased risk of COVID-19 with higher number of prior vaccine doses. Importantly, and it was not because, so you could rationalize why that might be the case. Well, maybe people who are getting the most jabs, the most doses of vaccine, are people who are older and higher at risk anyway. So then, yes, they're more likely to get COVID because they're higher risk. So it would just be incidental. That well, they're more likely to get a lot of vaccines and they're more likely to get COVID. But that's not, one doesn't have anything to do with the other. However, that is not the case here as they lay out at the Cleveland Clinic. They're like, okay, we see why you might think that, but most of the people in this study were young people. Some young people can be at a high risk of COVID if you have a pre-existing condition, but you would not expect that to be most of the people. And so they're saying that really makes this finding unexpected. Their risk of, the people, despite this, their risk of acquiring COVID-19, the people who had fewer injections, was lower than those who'd received a larger number of prior vaccine doses.
Yeah. So it's worth noting that the overall conclusions of the study is that the vaccines do work to
bivalent specifically.
The bivalent vaccines did work to lower the incidence of COVID, right? They work. That this is not the study is not saying that, and that ultimate conclusion should be taken into account. The question is whether at a certain point requiring or suggesting that people get multiple vaccines at a certain point, whether there is diminishing returns. So we should distinguish between getting a vaccine or incrementally boosted versus a certain volume that seems to have an unexpected effect. The paper also notes that this is not the only study to find a possible association with more prior vaccine doses and higher risk of COVID-19. During an Omicron wave in Iceland, individuals who had previously received 2 or more doses were found to have a higher odds of reinfection than those who had received fewer than 2 doses of vaccine in an unadjusted analysis. And it goes through some kind of technical scientific reasons why this might be happening, something called immune imprinting and some stuff with the spike protein that I think is beyond the technical know-how of us here. But it is being interpreted as validating some concerns and some anecdotal evidence that people have had that folks in their lives who got more vaccinations and more boosts seem to have succumbed to the virus more frequently than those people who only maybe got the first round or what have you.
And again, I could see for a very at-risk population or the elderly, you might say, well, even if this is increasing the chance you get COVID, honestly, the odds of getting, when a wave comes through, you have good odds of getting it anyway. You want, if you're an elderly person or immunocompromised person, the protection from the dose is more important than some slightly increased odds that you would get it in the first place, the odds being that you're going to get it anyway. However, to repeatedly boost younger people who are healthy otherwise over and over again, they might be saying, well, if I get it, I get it, but I'd rather not increase my risk of getting it, because if I get it, I'm probably going to not have such a bad time with it. And maybe I was, you were vaccinated originally, and we're just talking about subsequent doses, or maybe you had it before. They actually, in this paper, it does say that the multivariate analysis also found the more recent the last prior COVID episode, the lower risk of COVID. Saying again, that's the some kind of enduring natural immunity. And I just keep thinking how the places in our society that are still trying to take this decision away from individuals, like university campuses, where the bivalent, some of them, is going to be required still in the fall. That can, like, how how naive and unscientific it is to take that decision out of people and their doctors, and then also the attempts to suppress criticism of vaccines, calling it all misinformation that has occurred online and elsewhere for the last 3 years.
Well,
seems so short-sighted.
So a couple of things. First, it should be noted that this was an unexpected observation in this study, and they in the study say that it needs to be studied further. So that is, it's I wouldn't draw too many hard and fast conclusions, although I take Jimmy Dore's point that it does feel like if there is in fact a negative result, like making people more vulnerable to getting COVID, and they're just saying, well, we should have studied this more, I can understand people feeling like they are guinea pigs in this situation, right? That there should have been more of this kind of research that happened earlier, but there was a real hesitancy to do so when we were in the throes of the pandemic. But it's also worth noting that the objective or the biggest gain of getting vaccinated, we've now known for a long time, is preventing hospitalization. So this study is talking about whether or not people are more susceptible to actually succumbing to the virus, but there's a whole separate conversation about whether or not it's preventing you from having the worst outcomes here. So for young people who already tend not to have the worst outcomes, I think that's a really interesting question that you're raising about college campuses and the like. For even older people, there could be a calculation that says, sure, you might be this % more likely to catch COVID than you might not if you had gotten multiple boosters. But if you hadn't gotten boosted, you might end up in the hospital or be more likely to die. So it's better just to basically take on more softer waves than to wait for the one big one to take you out.
But this is yet more, or this is another point of data in the column of the group of people for which it is least justifiable, if you think it's justifiable at all, to require them to get vaccinated, is actually the population where the requirements were most likely, school-age populations.
Sure, yeah.
And that's so... People are going to feel, I think, so gaslit about all this stuff, saying, again, the initial promise, maybe implicitly, I guess, but a lot of people in the media reported it, was that everybody has to get vaccinated. We're really encouraging it, where we're not requiring it outright. We're encouraging it because this is how we're going to stop the spread, and we're going to get rid of COVID because we're going to have herd immunity because you're no longer going to be able to transmit it or get it when you're vaccinated. That didn't pan out. And on and on and on and on and on.
Yeah, that's
I'm not underselling the vaccines. I understand that they are, the findings are still that they're very protective against severe disease and death for at-risk populations, but the logic of the requirements was really, for the public health rationale, was really on stopping cases.
Yeah, I totally get that, and I agree that was the rationale, but it hasn't been now for some time.
Yeah.
And so I just think from a public health perspective, as people are considering these kind of studies, it's important to really emphasize that the stated goal for some time now has been to prevent hospitalization and death. And that vaccines, including this study, show that there is a significant benefit. When the vaccine is correlated to the strain that's happening, it does effectively lower hospitalization and death here.
Right. But again, you could have a more targeted, even based on this study, you could say, are you in this risk category? Yeah, look at this study. You would benefit from vaccination. On net, you would benefit because even if you're increasing your likelihood of getting COVID, the protection is important for severe disease and death. You are in this categorization. You're a healthy young person, and really all you're doing by getting your fifth or something dose is making it slightly more likely you're going to get COVID or whatever it is, and that doesn't make as much sense for you. And we have not had that approach at all, and people are going to feel I think justifiably outraged.
And I think that people like Jimmy Dore, who are saying, well, where was all this research? Why hasn't there been more research about what's going on with COVID? I think are completely right. And I think there also needs to be a sensitivity to and frustration about the lack of research with respect to long COVID as well. Whatever you think about it, whether or not it's credible or whether you're skeptical about how real it is as a phenomenon, the reality is that we are, out of ignorance about what's going on, allowing the government to basically ratchet back any protections, any long-term healthcare support for people with long COVID, any way to protect themselves against it, and also insulating the manufacturers of vaccines from any liability. There's a whole mixed bag of shielding that's happening for people who are going to have bad outcomes one way or the other. And I do think that before we are overly interested in saying, well, I don't think that long COVID is a thing because it's being used as a pretext for the government to have overreach, also downplaying the possibility of long COVID having this effect as being used as an excuse for the government to not have any responsibility for policies that may have set up a significant portion of the American public to be dealing with a crisis, a health crisis, where we don't have universal health care long after the government has washed its hands of all of it.
Well, I mean, as you know, I remain extremely skeptical of a lot of long COVID claims. However, I don't know
it should be studied. I mean,
it should be studied,
thing.
And I don't really know what people who are very worried about long COVID. I'm not sure what the state of their claims are with respect to, like, is it worse if you've gotten it more COVID more times, or is it?
It's correlated with the severity of the infection.
So if you've gotten it. If you get COVID a bunch of times, but none of them were severe, you're not going to get it.
No, it's also correlated with the numbers.
Well, that's what I'm getting at. So a vaccine that makes you, if you're, again, in a population where you're not at severe risk of, it's going to make you more likely to get it. Maybe from a long COVID perspective, that is a concern.
That kind of cuts both ways, but that's why I agree with everyone who's looking for more research and more studies. And I do think there is a real issue with there being so much delay here in getting some of this kind of information out.
Well, we'll have more Rising right after this.